Good afternoon, everyone. This is Congressman Blake Moore, and I'm coming to you from Washington, D.C. I'm in the middle of votes right now, so I'll have to do a couple votes or I step away. But we've got a great, informative town hall planned, and I appreciate you staying on the line. I appreciate you taking the time to join me. This is a very specific Medicare telephone town hall. We'll begin shortly in taking questions. You can ask a question by hitting *3 at any point, or you can stay on the line after the call's conclusion to leave a voicemail and have a member of my team follow up with you. So you can also hit *6 at any point to sign up for our weekly e-newsletter to receive updates on my activities in the 1st District and in Washington. Again, so *3 is what you can hit to ask questions. And we're just waiting for a few more folks to get on the line. So as people are getting on and getting settled, I'll just kind of explain what today's town hall is going to be about. After being sworn in over 10 months ago, a lot has happened. In the midst of the hectic activity, it's become crystal clear to my team and me that healthcare is one of the most important issues facing our nation today. One of the most important issues facing Utah today, and each and every single American has healthcare needs, and many often have issues facing a healthcare system that is complex and expensive. Today, I hope we help you find a way to meet your healthcare needs with confidence. Joining me on the call are two exceptional specialists from the Centers for Medicare and Medicaid Services, better known as CMS. And I'm going to defer a lot of the questions to them as they're taking some time with us during this hour to help answer these questions. So these two, they're here to answer any questions or issues you have and help you with any of this, provide guidance. As you are in the middle, right now we're in the middle of Medicare open enrollment period. And that's why we're doing this particular constituent service Medicare town hall today. While these specialists are doing fantastic work at CMS, I want to let you know a little bit about the work I'm doing on the legislative side of this issue. You can stay up to date on my efforts. Again, I mentioned it earlier, and we're trying to push down healthcare legislation, and you can follow our newsletter to kind of see some of the things we're doing. Again, to sign up for the newsletter is *6. To subscribe now or at any point during this call. Much has been written regarding the long-term stability of entitlement programs like Medicare. As you well know, Medicare is an extremely important program. It provides vital services to millions of Americans and many, many Utahns. Over 400,000 people are on Medicare just in Utah alone. We need to find solutions that will keep these programs stable for generations to come. Everyone who has been paying into these programs should not experience any changes. I'll always fight to strengthen the healthcare safety net for all Utahns. I'm investing significant time and energy on this issue, as is my team. While we take the time today to make sure your health needs will be met today and next calendar year, I want to provide that assurance that we're also looking to ensure your needs are met for years to come. With that said, I will introduce to you the CMS specialists that will be joining our call. As I do, feel free to hit *3 to ask a question. Joining us, we have Dennis Del Pizzo and Lisa Blale. Again, that's Dennis and Lisa. Both Dennis and Lisa work for the Centers for Medicare and Medicaid Services in Denver. CMS is a federal agency within the U.S. Department of Health and Human Services and is responsible for the administration of Medicare, federal health insurance marketplaces, and it provides broad federal oversight of Medicaid and the Children's Health Insurance Program, which is commonly known as CHIP. The CMS Denver Regional Office is one of 10 regional offices nationally, and it serves Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Dennis is a health insurance specialist. His primary responsibilities include coordination with CMS's regional outreach and education for the 6-state region, and he has worked in the Medicare program for over 32 years. Dennis, please introduce yourself to the group.
Good afternoon, everyone, and thank you, Congressman, for the introduction. And both Lisa and I are looking forward to the opportunity to answer your questions and talk about the Medicare open enrollment period and more broader CMS programs, and any questions are on the table, and we're happy to address them. Thank you.
Thank you, Dennis. And next we'll have Lisa introduce herself. She's also a health insurance specialist and with 30 years working on Medicaid, or Medicare program in both the original Medicare and Medicare Advantage Part D area. So again, 32 years and 30 years, that's almost enough years to be eligible for Medicare of the amount of time that they've got covered on working on this. Lisa, please introduce yourself.
Hi, everyone. My name is Lisa. Thank you so much for having us. As Dennis said, any questions are on the table. I'm looking forward to this event. Thank you so much.
Okay, we want to jump into it with any particular questions you have. Reminder, *3 to enter the question queue. Okay, Jennifer Taylor. Do we have you, Jennifer Taylor?
Yes, I'm here. Can you hear me okay?
Yes, ma'am. Thank you.
Okay, wonderful. Well, I first just wanted to thank you so much, Representative Moore, and thank you to the Medicare and Medicaid reps who are here today. I'll try to keep my comments short and my questions short. My name is Dr. Jennifer Taylor, and I'm one of your constituents. And November is Pancreatic Cancer Awareness Month, and most cancer awareness months involve encouraging people to get regular checkups, eat healthy, limit alcohol use, don't smoke, and exercise. My mother did all of that, and she still got pancreatic cancer. And it's notoriously difficult to diagnose in its early stages. It's one of the rarest of all cancers, and it's also the most deadly. So how do you slay such a beast? Well, one thing that helps is research funding, and so do better and more cost-effective treatments. But because pancreatic cancer is relatively rare, few dollars actually go into supporting research for life-saving treatments. For reference, funding for pancreatic cancer research this year is 4.5 times less than of breast cancer research. And the 5-year survival rate for pancreatic cancer is only 10%. For breast cancer, it's 90%. Research dollars help. And for those living with pancreatic cancer, lowering the cost of exorbitant medications helps too. Just one of my mother's medications that was essential with every meal, simply to digest food, cost over $800 a bottle with Medicare insurance. Sometimes she would have to take 6 or more every meal, and at least one with every snack. I had to encourage her not to ration her meds or skip snacks because she knew she would have to take more. We went through maybe 2 bottles a month, and it broke my heart because she would cry about us having to spend such expenses on her medicine. No cancer patient should experience that. After hours of phone calls to try to find grants for Creon and Zimpath, all of which are stalled, by the way, there's no current funding for them, and phone calls with both manufacturers who advertise that they may be able to help, I discovered that my mother was disqualified because she had Medicare. Medicaid also disqualifies patients from discounts too. And I was appalled. How can anyone get away with charging $800 per bottle for life-saving medication? At one point, my mother was taking over 20 pills a day. Those costs add up fast, even with Medicare insurance. In fact, if she didn't have Medicare, the medication could have been free to her through the pharmaceutical company. I was so appalled by this that I spoke with a friend who works for a pharmaceutical company, and I found that Medicare and Medicaid restrict patients from receiving discounts from manufacturers such as copay cards. And the reason is because if there is a discount, Medicare wants the discount. No other insurance is like that. That needs to change, and it needs to be done at the federal level. If that gets changed, that would be a critical relief to patients. Cancer is hard enough on the body physically. No cancer patient deserves to add emotional and financial stress to it as well. We can do better, and we must do better. My mama taught me to fight for what's right. She taught me to stand up for those who are hurting, and she taught me to use what I can to work towards a better future. I hope that together we can honor her and we can collaborate to allow discounts on medications through Medicare and Medicaid. So I would like the Medicare reps to explain why copay cards are not allowed and what they will do to commit to lowering the cost of these critical medications. And I would also like to ask Representative Stewart if he would support championing these discounts, such as copay cards for those who have Medicare and Medicaid. I lost my mother in September, and so this is a very important issue to me, and I saw the struggles. So I would really like to know a response from Medicare regarding this, and also from Representative Moore. Thank you so much.
Dr. Taylor, this is Dennis Alpiza with the Centers for Medicare and Medicaid Services. And number one, I'm sorry, and number two, thanks for bringing this issue to our attention. I'm not knowledgeable, up to speed or knowledgeable about this particular provision, and us not being able to look into this. I would like to talk to you offline, and I'm committed to finding you the information and answers that you are asking us. My direct line, so that you can reach me, is 303-844-1994. I am texting our regional pharmacist as I speak, so that I can get a little bit more information too. But please call me. I'd like to talk to you offline and provide answers, direct answers to your concerns and questions that you raise. And I apologize, and I'm very sorry about your mother.
Thank you. Unless Lisa has anything to add, Dr. Taylor, I too, if you wanted to provide the specifics of your questions to our office, we can follow up with you as well. We have a healthcare individual over everything legislative here, and I'll have him work directly on that. So thanks, we'll flag that as something to be looking for. Next, we have Mike from Brigham City.
Hi, this is Mike. Got a simple question. I'm really concerned about what the Biden administration is doing to mandate people taking the vaccine, knowing that there are some people who have natural immunity from having had it, and those that physically can't take it will kill them or hurt them really bad. Do you see anything coming down the line where we have to worry about Medicare being trapped into this mandate thing so that if you don't get the vaccine, you don't get your Medicare?
Dennis and Lisa, I'll defer to you. Yeah, please.
Dennis
Thank you.
with CMS. Congressman, do you want to take that?
No, I was going to defer to you first on anything specific to Medicare.
Okay. I'm not aware of any requirement like that coming down the pike, or any provisions like that coming down the pike. So I can't speak to anything other than what is in law. And there's requirements that healthcare workers, and these are usually certified facilities, their healthcare staff, there is a requirement that they get vaccinated. Again, it's more looking at the aspect of public safety and keeping people safe, and especially in the delivery of healthcare. And so there will be those requirements with some exceptions, but I'm not aware of the provision that you're speaking about, or I've not heard anything about that.
Yeah, I'll add, this is obviously a very tough issue for many people, and it's on the minds, I know, first and foremost of our workforce, that as mandates come down, that people could potentially lose their job, which is an overextension by far. It's something we're strongly against. And as I've explored this as much as I possibly can, and I am not a physician, but there's a role that I play in here, and I've dug into this as much as I possibly can with experts, with constituents, with companies. But we've missed the mark, and President Biden has missed the mark with these mandates that he's pushing down, in my opinion, where the concept of natural immunity needs to be more on the forefront. And I think by doing that, we will get more folks to become vaccinated, because as I continue to learn, the natural immunity, even the larger medical community, does agree of its effectiveness against the disease. But if we rely on natural immunity, more people will get the disease, and we will face more variants being spread. So that's the sort of catch right there, where the vaccine can be more productive in fending off that issue. More people, if they wait to get disease to earn that natural immunity, then you will see more deaths and more deaths take place. Now, I got naturally infected last year about this time, and then when I had the opportunity to take the vaccine, I did, and then I just went and got an immunity test done, and I've got my S1, S2 nucleocapsid. I may be saying that wrong, but a strong, healthy immunity to this, and it's through all of those measures. And so I agree with you. We need to make natural immunity more of the conversation, and I hope that by doing that, we get more people to embrace the vaccine. And so, but with respect to the Medicare, I'm going to defer to what Dennis said. I have not heard anything that's going to be pushed through the Medicare and not being allowed benefits and things to that nature. And that would be another strong push back against the administration if something like that were to ever come to light. So thank you for the question and leaning in. I know that's it's a big issue for lots of folks. Sharon from Clearfield. Sharon, are you on?
Yes.
Thank you.
My question
Go ahead,
is,
Sharon.
my question is I am on Medicaid. What is going to happen next year when I turn 65? Continue to be on Medicaid. Am I going to be eligible for Medicare and Medicaid?
Yeah, so what will happen next year when you become eligible for Medicare, you'll become what we call a dual eligible, and that's an individual who's eligible for both Medicare and Medicaid at the same time. And just because you're going to be eligible for Medicare does not mean that you're going to lose your Medicaid coverage. You could, and you'll have to look at it and make sure. But as long as your financial situation doesn't change, Medicare will be the primary payer, and then Medicaid would kick in and be the secondary or the payer of last resort. So you'd have pretty comprehensive coverage with both programs.
Excellent. Thank you, Dennis. Thanks, Sharon. Phil from Park City.
Yes.
Please go ahead, Phil.
Hi, my question is this. I'll turn 65 later this month. I am employed and covered under my employer's health care plan. My question is whether I still need to sign up for Medicare this year, and is that dependent on the number of employees in my company?
Thanks, Phil, and that's a good question, and that's a common question that we get a lot of. And so for people that are continuing to work that become eligible for Medicare, a lot of times those individuals will delay enrolling in Medicare because they have active employer coverage. You also added it doesn't matter how many employees are part of your employer program. And yeah, what Medicare looks at as far as coordination of benefit rules is we look at employers with 20 or more employees. And so to put this all together, if your employer has 20 or more employees, your employer coverage would continue on and be the primary payer. Medicare would be the secondary payer. Many people will pick up Medicare Part A, which is hospital insurance. It's premium free, but delay enrolling in Medicare Part B, the part of Medicare that has a premium we call Medicare Part B medical insurance, until they fully retire. But the key to your question is, yes, you could delay enrolling in Medicare if you're actively employed, but we would look at is your employer plan 20 or more employees? And that's how we look to coordination of benefit rules as far as who would be the primary and secondary. If it's under 20, then you most likely would want to enroll in Medicare because your employer plan would revert to a secondary payer once you become Medicare eligible. Hopefully that addresses your question.
Thank you, Dennis. And again, on any of these questions, folks, if there's further follow-up, please feel free to reach out to our office. It's not always easy to answer everything in this setting, but we wanted to get to as many people as possible. I believe next is Bob. Bob, if you were on the line, I don't want to share your last name if I don't have to, but Bob, if you're on the line, are you available to chat?
Yes, my question is, why is the Medicare Advantage plan different for people in different areas? In Sevier County, the benefit is not nearly as good as most areas of the country.
Yeah, thank you for that question. And again, that's an important issue because ultimately we want access and freedom of choice, giving individuals with Medicare multiple plan options so that you're just not stuck to one plan offering. But in the Medicare Advantage arena, these are private companies and they contract with the federal government to provide Medicare insurance to Medicare beneficiaries. In rural parts of states, Medicare Advantage plans have difficulty contracting with providers. And so one of the key things that prevents maybe Medicare Advantage to be more available and have additional options in rural areas is the availability of providers and the availability of plans to be able to put together a network adequately in order to cover people on Medicare. And so those are the issues that these private companies, the Medicare Advantage plans, face in offering different plan options in different states. Like when you look at Congressional District 1 in Utah, you can have some counties with as few as 8 plans and other counties, as you're describing, with as many as 28 plan offerings. But it really depends on the availability of the providers and the ability of these plans to establish networks to deliver care to individuals on Medicare. And they have real difficulty a lot of times in rural areas doing that.
Thank you, Dennis and Bob. I'm going to bring Dennis to all my town halls. Let him answer all these technical questions. No, I'm joking, everyone. Pat from Clearfield. Pat, are you on?
Well, it could be Tab. So
we'll go with that. You're on. So let's go with it.
Okay. We're getting a lot of Medicare Advantage TV spots. I mean, it's like overwhelming, and I guess my wife has looked into it a little bit, and she's concerned about the program because, to her knowledge, you get more limited availability of providers and doctors, and they're a little more restrictive. So that it's possible that if you already have a doctor, if you go to a Advantage plan, you might not have the same list of doctors. When you get older, you have more doctors. I have like 4 or 5 I have to go to on a regular basis. And so the question I have is if that's true. And then a follow-up question is I've been told that once you get onto Medicare Advantage, you can never go back to regular Medicare coverage, which is kind of concerning. So that's those 2 questions I have.
So, and Lisa can chime in too, but to address your last question first, not true. So Medicare coverage is not concrete. And what I mean by that is you can always change, at least annually or sometimes more frequently throughout the year. It depends on your situation and if you qualify for a life event. But you can always change your coverage annually. And kind of that's why the Congressman and his staff were offering this town hall, is to promote and raise awareness regarding the Medicare enrollment period, which is occurring right now, October 15th through December 7th, which is the opportunity for all Medicare beneficiaries to look at their health coverage, make an informed, active decision based on what is happening with their existing health coverage. Is it changing much? Is the networks like you described and the availability of doctors, specialists, and their pharmacy changing. What are premiums and cost sharing doing? Take a look at that, and if there's significant changes, there's a lot of times other fish in the sea that people have options and choices that they can select, maybe providing them lower costs and better options. But you can always change your Medicare coverage. Your first question that you raised was the TV ads. We just sent out a memo, I believe, either the end of last week or the first part of this week, to all Medicare Advantage organizations, reminding them about their marketing requirements as part of their contract with the federal government, and that they are responsible for all first tier and then downstream and other entities that do marketing for these organizations, that they need to, number one, make sure that the ads are truthful, honest, and not misrepresenting their plans or their coverage. And a lot of times you'll notice in these national ads that you don't hear any company mentioned too. But we're trying to crack down on that and to have Medicare Advantage plans start policing that a lot more than they have been, because the television ads at the football star, you might see the football star on and offering all the goodies, including a Social Security payback, might not be available in all areas of the country. And so we are trying to address that very important issue. We hear it from beneficiaries, we hear it from advocates, and hopefully we will begin to address this and take a look at further further actions that we might have levers to pull to bring plans into compliance with their downstream entities that do some of the marketing that we're discussing here. And then with the limited networks and the issues you related to, that's one of the considerations we have to take a look at. Is my healthcare provider or my healthcare providers, primary care specialist, pharmacist, a member of that network? And that's the things that we have to look at as we take a look at not only the big driver, which is cost, but also how the plan works for the providers that you receive care from, or the pharmacists that you fill your prescriptions with, and how convenient are these providers to where you reside. So those are all things that we have to take a look at. The trade-off probably for original Medicare versus Medicare Advantage. Original Medicare is the fee-for-service program. Medicare Advantage is what I mentioned, these private companies that contract to provide everything that's covered under original Medicare. Some offer more services and benefits. And the trade-off is original Medicare provides freedom of choice. Probably don't need a referral to go see a specialist. Probably you don't need to pick a primary care provider, but you could have 3 premiums: a Medicare Part B premium, a Medicare Part D premium, and a Medicare supplement or a Medigap policy premium. With Medicare Advantage, it could be less costly way to receive your Medicare benefits, but the trade-off is there could be more restrictions. Having to stay in the network. If you go outside of the network, you might have to pay a higher cost. Those are things we have to look at. I apologize for being long-winded, Congressman, but just trying to be thorough and address the question.
Oh, that's very helpful. Thank you. Next, let's go to Scott in Brigham City.
Yes, the question I have would be for your guest from CMS. Are you aware of these telemarketers soliciting Medicare beneficiaries without permission? And if so, what, if anything, are you doing to crack down on that? Because as I understand it, that's against all CMS guidelines, rules, and procedures.
Scott, any concerns with marketing? Please report that to 1-800-MEDICARE. We want to look at every and each allegation, and each one of them stands alone. But yes, Medicare Advantage plans, Medicare prescription drug plans are bound by strict marketing requirements. And if you are getting unsolicited calls that you have not requested them to contact you, please report those issues to the 1-800-MEDICARE program. You can also reach out to, and this is a good time to plug, your state health insurance information and assistance program, or the SHIP program. This is a grant that the Department of Health and Human Services provides to every state. In Utah, it's administered by State Aging, and their telephone number is 1-800-541-7735. Again, 800-541-7735. You can report that to either entity, because we want to look at that and take a look at the situation too. And we will a case will be logged, and we will follow up with the plan regarding the allegation.
Yeah, and unfortunately, we only see more bad actors in this space with continued robocalls and things like that. I know that cell phone companies are doing as much as they can to block some of this as well. So thanks, Dennis. That's great, and providing information. Please, I'll reiterate that. Like, information helps those that are trying to thwart these to collect information and data so they can do a better job going forward. Let's jump over to David in Cache Valley. David, are you on the line?
I'm here. Can you hear me?
Yes, sir. Thanks so much. Go ahead.
So I'm a federal retiree, retired in 2014. Decided to keep my FEHB benefit and keep paying that, which I've done, and declined the Part B. Got bad advice apparently from my retirement office. And the plan that I've been in has gone up like 225% since 2014 for my portion of it. Thinking about switching over to Medicare Part B, I've got a father-in-law who pays almost nothing with his supplemental insurance for, doctor's visits and prescriptions, or other than the donut hole. It just looks like a better deal. But it's 10% per year penalty for me and for my wife to get signed up to or switch over to Medicare Part B now. I can't quite understand why the penalty, because even though I'm not retired or I'm not employed, I'm still paying the insurance as if I were employed. So is there a way out of this mess?
David, I don't want to promise anything. And thank you for your federal service. A couple things are in play here is bad or misinformation from your retirement office. So we'd want to take a look at that. And Social Security has a provision called equitable relief, where we can take a look at allegations such as this and information that they have logged into your history and your account. And we could see if there would be, we'd probably want to get more information from you to take a look at the situation in more detail. But that's something as federal employees that we all have to make a decision at when we retire. Number one, we're lucky we are not required to take Medicare if we so choose, and our federal employee health benefit plans will continue paying. But I always encourage people to strongly, in your situation, to strongly encourage Medicare, both parts of Medicare, Medicare Part A and Part B, just because of the comprehensive coverage that it provides. But we would want to take a look at your situation and probably encourage you to reach out to the Social Security Administration and to see if anything can be done based on the misadvice of a federal employee when you were making this important decision back in 2014. So that's what the first thing I would encourage you to do. Or you could reach out to the state SHIP program. Again, that telephone number, 800-541-7735. and they could also help and assist in this matter too, as they have contacts and work directly with Social Security pretty regularly.
And I'll just quickly add, David, that I hope you've been able to connect with one of my staff members. So whatever we can do to help navigate this as well, please feel free to use that contact info, and we'll do what we can. So sorry you're in this situation. Another reminder to sign up for our newsletter. And folks, the newsletter is not something, we don't spam with this newsletter. We simply send one email every week that tells you kind of what our activity's been, updates on things like this town hall, and other things going on. We really try to make it informative and use it as a way to communicate with you all. So *6, you can sign up for the newsletter. We appreciate following along and keeping up to date with what we're doing. So again, *6 for the newsletter. And if you want to ask a question to get in queue, it's *3. We've had awesome questions so far, so thanks everyone. John from Ogden. I've got John from Ogden. Are you on the line?
Yes, I am. Thank you. I'm curious. I'm 73. I'm on Medicare, and I have a supplemental. But I'm not really clear on what the various programs are. I mean, I know I have ABC, but are there actually alternatives in there that I should be looking into?
Yeah, so absolutely. And the Medicare program was designed, and there was big changes at the end of the 1990s that created options and choices for Medicare beneficiaries to not just have the option of original Medicare, the fee-for-service program, which you have now with your Medicare supplemental, but to give you other options and choices, and to give every Medicare beneficiary options and choices in receiving in how they receive their health care, whether it's through one of these private companies, these Medicare Advantage plans, or continuing to stay with original Medicare. With the Medicare Advantage plans, and I believe Medicare Advantage is available in all parts of Utah, and I did not see any orphan county in Congressional District 1 in Utah. As I stated, I saw at least 8 plan offerings with a maximum of 28 plan offerings, depending on county. So what you'd want to take a look at right now in the Medicare open enrollment period, since you're established Medicare beneficiary, is maybe to take a look first and kick the tires and go out to Medicare.gov and click on the Find Health and Drug Plans, enter your zip code, and you can begin to see which plans are available in the zip code where you reside. And then from that, you can narrow it down a little bit, maybe enter the drugs you take, if any, the pharmacy you prefer to use, and narrow down your search a little bit depending on, again, your locality and which plan offerings are available specific to your locality. Because there might be a better option for you at a lower cost and providing better coverage and maybe some additional services that original Medicare doesn't cover. Again, we want what's best for you. We don't care about the person down the street or your uncle or a relative or friend. We care, about you, and we want you to have the coverage that works best for you. The SHIP program is available to help you if you're just overwhelmed or don't know where to start. But at least taking a look at Medicare.gov yourself and finding what plan options are available. Do they work with your healthcare providers? And then maybe contacting the SHIP to receive additional in-person assistance, or reaching out to 1-800-Medicare to receive some additional assistance, answer your questions. They'll throw out some of the considerations you should think about, but the decision is always yours, and we always remember that Medicare coverage is not concrete, and you can always change back. And one of the things with the Medicare supplement like you have now, that's the only Medicare coverage that it's impacted by medical underwriting. So if you give your supplement up, you might not be able to get it back, but there is a period of time Advantage if you and it's going to work best for you to see how it works before you decide that, hey, this is the best thing since sliced bread, and it's really working for me, saving me some money, and it's providing better coverage than I had before. But what I was alluding to is we have some trial rights that allow you to kick the tires, and if you hate it, you can return to original Medicare and have a guaranteed issue to pick up your Medicare supplement again. But again, those trial rights only last for a period of time, usually up to a year, to give people the option to take a look and see what's best and what works right for them.
Thank you, Dennis. Okay, next we have Delon and Clinton. I apologize if I'm saying that wrong.
No, that's good. You got it.
All right, I did all right.
So
go ahead, sir.
Yeah, thanks for taking the call. So my question is, I'm going to be eligible for Medicare in the next couple of months, but I'm covered under an employer insurance policy right now. I've been told, well, I was looking at AARP, and there was an indication there that if I'm covered under a high deductible policy, and there was an indication that said I would not be eligible for a high deductible policy if I participated in Part A of Medicare. And I don't know, that's my question, is that true?
So I believe what you're explaining and what's going on there is that you're currently have active employer coverage. You're going to be becoming eligible for Medicare in a couple of months. It sounds like you're covered through your employer through a two-part plan, which is number one, a high deductible health plan with a health savings account. And so it's not a CMS, the Centers for Medicare and Medicaid Services, or a Social Security provision. It's an IRS provision. And what it says is that you can no longer contribute and fund your HSA if you enroll in Medicare. And so you'll want to be cognizant of that. There's a little bit of information regarding this in the Medicare and You handbook that you can read. And if you haven't received a copy of the handbook, you can order one by calling 1-800-MEDICARE. But that's probably what you're describing is that provision. So while you're actively working, you might not need Medicare coverage, and especially you would want to not enroll in Medicare if you're enrolled in this type of coverage through work until you fully retire, and then you'd want to probably work with your benefits specialist and your HR department at work, because a lot of them are pretty savvy about this requirement and could help you navigate and shut off your HSA so that there's no IRS penalty for funding your HSA as you approach and decide I'm going to retire and I need to enroll in Medicare. So I'd work with your employer benefit specialist. I'd reach out to them first, or your tax advisor, to understand more of the provision, or you can check and read IRS publication 969. It has more information for you regarding what you're describing.
Excellent. Folks, I am really appreciative of people getting in queue and asking these thoughtful questions. Again, as a reminder, healthcare is an incredibly important thing to every single constituent. So even if we don't get to every question on this call, which we won't, please feel free to reach out to our office. We can help coordinate however best we can. This is the type of work, constituent service, is the type of work that gets overlooked a lot of times by like media or other folks. And that is a big part of our job, and we take it serious in our office and want to help out as much as possible with this and just help you navigate Social Security, Medicare, all that type of stuff. Let's next go to Linda from Roosevelt. Linda, are you on?
First of all, I would like to say thank you, Congressman Moore, for sponsoring this town hall. The question I have, here in Duchesne County, we finally have a choice between let's say, more favorable Medicare Advantage plans. Last year we only had a choice of one company. This year we have a choice of two companies. And my general question is whether an HMO plan or a PPO plan, which would be the best one to participate in?
Again, it depends on what's most important to you. Number one, making sure that it's either option would work for your healthcare providers. Now, an HMO is going to be a more restrictive network, and that if you go outside of that network and it's not an urgent or emergent situation, it could be your nickel. So you'll want to pay attention to that unless the HMO has a point of service option that allows you to go outside of the network. With a PPO, you have a little bit more flexibility in that you can go in network and pay lower copays, but also have the opportunity to go outside of the network and still be covered, but pay a greater cost-sharing amount for doing so because you're not using network providers. HMOs are going to probably be the most cheapest plans available. PPOs are going to be a little bit more expensive for that for those fewer restrictions that are available to you. So you'd want to probably take a look at your number. You know, cost is a big driver always for everyone, but also the provider access, and then talk to both companies to make sure you understand. You understand how each company operates, what you're allowed to do, what the requirements are going to be. Are you going to need to pick a PCP, a primary care physician? Are you going to be required to get a referral to go see a specialist? Are you going to need to get certain things pre-authorized? Ask some of those questions. Write down some of the things that are important to you. Interview and ask each company. And they should respond clearly to you so that you understand and can make an informed, educated decision about what's right for you. And the state SHIP program, again, 800-541-7735, they can help. 1-800-Medicare can help. But hopefully that at least it addresses the fine points of HMOs versus PPOs. And Lisa, I don't know if you have anything to add.
No, Dennis, I think you covered that very well.
Excellent. Okay, continuing on to Melva from Taylor. Melva?
Yes, we have the state insurance, and our premiums are pretty large, but we don't get a prescription plan with that, and we want to keep that state insurance because it's excellent. But the problem is that my husband takes Creon, which has become gold-plated. It's a pancreas medicine. If he doesn't take it, he dies. And so our copay on that is $500 a month. We get it from Canada for the same price. If we get it from our insurance, it puts him in the donut hole really quick. So is there any kind of help for people that have, and he takes Symbicort too, high-priced drugs? And, you know, we're educators. We, we didn't make a lot of money, but, you know, we're certainly not in the case of a lot of people that don't have what we have. But we feel like that we are being punished for having illnesses that he didn't cause. You know, he simply had a bad, and the doctor wasn't responsible because they damaged his pancreas in taking the gallbladder out. And that's why he has, it's not because, that's why he has what he has with pancreatitis. And it's not really anyone's fault, but here we are. And so at the end of when we do our medical, it comes up to about $12,000 a year for each one of us. That's a lot of money. So I'm wondering if I could get some help with anywhere that we could get help with his medicines. I'm okay, but he is not.
Again, I'm very just sorry to hear about the situation that you described and what transpired. To address your question, and you stated your state employees and you're eligible for state insurance, but it does not provide drug coverage. I'd always check with your retirement office to make sure that you don't do anything to jeopardize the coverage that you have. But if you're allowed to join a Medicare prescription drug plan, which it sounds like you are allowed to do separately from the retirement insurance that you have, there is a low-income subsidy program. I don't know if you would qualify or not, but that provides some financial assistance to beneficiaries that have limited income and resources in helping them cover the cost of their drugs. As Dr. Taylor originally mentioned, opening up the program is we don't want anybody cutting their pills in half or going without taking their medications, because that can lead to really some bad health outcomes and costing both you and the program lots more money down the road. That's a couple provisions that you could take a look at. And also shop around. There are 21 different Medicare plans available, prescription drug plans available in Utah. Have you reviewed the Medicare Plan Finder tool or asked for assistance through the SHIP program to see if there are any one of those 21 plans that might be able to get that cost down a little bit if you don't qualify for financial assistance? Because that would be another avenue that you could take a look and see if there is another fish in the sea, another plan offering that would provide better coverage for the type of medication that your husband requires. And again, always working and talking to your healthcare providers too, because they might have some solutions and resources for you as well.
Okay, I think we're down to the last two questions. First, we'll go to Jody from Roosevelt.
Hello. First of all, thank you for taking my call, and thank you for this forum. It's been informative. I appreciate it. I am going to be a first-time enrollee soon in the Medicare program, and am looking for my best supplement plan and Part D plan that's available, and researching Medicare parts and trying to become educated on what might be covered. I have a lot of insurance needs, and I have, kind of to my dismay, found that I'm not seeing any type of mental health coverages as far as visits, as far as therapies, counseling. It's such a huge part of our society right now, and there are so many helps out there, and regular insurance seems to cover. The plan that I've had covers up to 8 visits a year, which is great, better than some. I'm not seeing anything at all covered by Medicare. Am I not searching enough, or is it true that that maybe by 65 we're not supposed to have any issues anymore? Is there a coverage for any mental health visits that I'm not seeing?
Yep. Absolutely, Judy. This is Dennis again, too, and absolutely, Medicare provides a pretty comprehensive coverage for mental health therapy, whether it's treatment, therapy, diagnostic screenings, etc. But Medicare provides pretty comprehensive coverage for mental health. So that would be very similar to employer group coverage. So you should be able to look on the Medicare.gov website under the coverage tool for the types of services that Medicare covers. The one thing in full disclosure, and that is the issue with all mental health, and it's not just a Medicare issue, but it's a commercial insurance issue or it's an individual market issue, is access to mental health providers. And that's the one thing that you need to be cognizant of and take a look at too. So if you have providers that you work with, you might check with them and ask around too and ask what types of insurance coverage that they have, but Medicare does provide comprehensive mental health coverage.
That's really great to know. I love that question. It's all about, it's all about reversing the stigma of a lot of mental health too. So great question, Jody. Thank you. Last question will be, again, *6 for the newsletter. Really appreciate folks following along. *6 for the newsletter. And we will go to Cindy in South Weber for our last question.
Okay, thank you. I've been retired for 1 year. I am now eligible for Medicare. My birthday's in December. And I've been going back and forth, whether to take it at all. I was advised when I retired to leave Medicare alone, to stick with my insurance and leave Medicare alone. But now as I'm listening to your forum again, I'm right back to, oh no, should I be on it? One of the questions you had answered that possibly because I am now eligible for Medicare, my own company will now say, oh, we are now secondary to you. And that makes me worry, oh, are there things they're not going to cover that I'm used to them covering? And I was also advised that the penalty would not apply to me as long as I held this coverage, and then at some point if I said, no, I guess I'll now go to Medicare, that I would be fine. So advise me, please.
Are you a retired federal employee?
Yes, I've been retired for a year, but I turned 65 this next month.
And you were a federal employee?
Yes.
Okay, yeah. So again, sounds like you're recently retired too. So as federal employees, we have the option, and the big decision for federal employees is, am I going to take Medicare Part B, the part of Medicare that does have a premium along with Medicare Part D, or not? And you have to look at your financial situation in totality. And I am not a financial advisor. The Congressman's not a financial advisor. We don't have access to your full financial picture to advise you. You don't need Medicare Part B. You're fine. I don't know what type of pension you qualify for, civil service, or if you're on the other pension plan for federal employees, which is called FERS. I don't know about your savings and how much you've been able to put away for retirement and your retirement years. You'd need to take a look at that working with a qualified financial advisor who is knowledgeable about federal employee benefits, because you need to take a look at your overall picture and determine, is Medicare right for me or not. I always encourage you to actively consider and do your homework. Go out to your Medicare, your federal federal employee health benefit plan brochure. Read Section 9 and reread Section 9. It covers the section of how your federal employee health benefit plan works with Medicare coverage. What is the advantage of enrolling in Medicare? And some of the federal employee plans are beginning to incentivize federal employees, retirees, in that they're going to provide some Part B reimbursement to encourage you to enroll in Medicare. So take a look at Section 9 of whatever plan you are enrolled in your brochure, and that will answer a lot of questions. And you might want to talk to a financial advisor, as I said, because we do not have access to your entire financial picture, and we're not qualified to give that type of advice.
Dennis, I'm going to have to wrap up here quickly, but Dennis, let me ask one more question on top of that. Cindy, that's an excellent question. If she makes a decision next month, what are any particular things to be thoughtful of that if she were to change her mind, like someone else on the call had done maybe 5 years from now? Like, is there any things to consider while she makes this decision this month?
Probably the most important thing is the type of federal employee health benefit coverage that she has, and then what it's going to cost for her to have both, Medicare and her federal employee health benefit plan. Is she going to be impacted by income-related monthly adjustment amounts, we now means test Medicare premiums in the sense that if we have incomes above $88,000 as an individual or $176,000 as a couple, we're going to pay a greater share of Medicare premiums. Taking a look at all of that in general, and probably going back and reading Section 9, there's a lot of good information, and also contacting or going out to the Office of Personnel Management because they have some good information and resources for federal employees too. And you could be in a window, I think you said about 6 months, so like you could be in the special enrollment period, so you could have an additional 2 months to pick up Part B without incurring a penalty. So take a look at your situation, contact a SHIP, a State Health Insurance Information and Assistance Program, and again, contact the Congressman staff who would contact us. We'd be happy to help with any additional information.
Thank you, Dennis. Makes a lot of sense. Candidly, I wouldn't have even known these were decisions to make, so I'm really glad to be, communicating that out to folks. I think you hit it on the head. We are not experts in our office either. What we can do is facilitate. On this topic in particular, with regards to Medicare and health insurance and Social Security, we can help facilitate, and we ask that you reach out, and we will do our best to kind of get you to the right folks, just like today's forum. Dennis and Lisa, this was very, very helpful. I thought these questions were exceptional, and hopefully were helpful to others as they were listening in. And we will try to do something like this again in the new year as well to help folks. But right now, with the enrollment period, please dig in, figure out what's best for your situation. Don't just take the standard option and ask the hard questions, and let us know if our team can help in any way. *6 for the newsletter. You can follow us on social media platforms at Rep Blake Moore. And again, with this particular topic, we'll call our office and we can help you get in touch with CMS. Dennis and Lisa, thanks again for taking the time.
Thank you very much.
Yeah, thank you all.